This is the Medical Minutes Podcast on the All Indiana Podcast Network. Your source for the latest news, updates, information, and more from the world of health and medicine. Now, here's Wish TV's medical reporter, Dr. Mary Gillis.
From Wish TV, I'm medical reporter Dr. Mary Gillis, and this is Medical Minutes on the All Indiana Podcast Network. The FDA is slated to ban menthol in cigarettes. A new study projects over 1 million Americans will quit smoking as a result. A majority will be Black. In this week's episode, I speak with Dr. Cynthia Meneghini, physician and smoking cessation specialist at Community Health Network. She tells me about the major public health impact of the menthol ban could have, considering smoking is a major risk factor for almost every chronic illness in Black Americans. Our conversation is next. So, Dr. Cynthia Meneghini, Community Health Smoking Cessation Specialist and physician, great to see you. Thank you so much for being with me.
You're welcome.
So the FDA is slated to ban menthol in cigarettes. So first, can you tell me what menthol is and why is it so dangerous?
Yeah, menthol is an additive that is in some cigarettes. It makes the cigarette easier to smoke. It decreases the coughing reflex, and it allows people to just take a deeper breath. They say it makes cigarettes much more pleasant, and so it contributes to many of our teenagers using menthol-related products.
And the dangers you mentioned, why is this? Why is this something that needs to be, or that the FDA is considering banning? And why do you think now?
So they've been looking at banning this for several years, but the time is now to take this huge step, because we are losing millions of people to smoking-related illnesses every year. It costs so much money. And so if the FDA can make this ban, it will mimic bans in other countries like Canada, which saw more than a 5% overall quit rate. And that was about 789,000 people.
That's a great number. And so the menthol in the cigarette is what I just want to circle back to, is that it makes it more pleasant. There's something about it that makes the smoking more pleasant, which then I would imagine that people are going to smoke more.
Yeah, it kind of overwhelms the overall, I would say, nasty or irritating part of the tobacco leaf that when you inhale, that menthol it's almost like putting an ice in your drink. It's an ice in your cigarette, which just makes it easier to smoke.
Without it, what would it be like without this? And why do you think? Why do you think people would quit? Because we don't have that kind of like buffer, that sort of ice that you referenced. Good analogy there. I'm curious why people would quit.
So some smokers only smoke menthol cigarettes because other cigarettes are so harsh and cause a lot of coughing. And so when they looked at the stats in Canada, some people, yes, did convert to normal cigarettes, but many quit because menthol is so much more pleasant.
Okay, so this added pleasantry to this type, and people are just sort of like this type of cigarette. Okay, so the new study suggests that 1.3 million Americans are slated to quit. How much and in what ways will this impact public health, do you think?
It will impact public health in an amazing way. For every cigarette pack that is purchased, we spend $7.57 in healthcare costs. In Indiana alone, it's $3 billion for healthcare costs, 500,000 of which is Medicaid money that all of us contribute to. All of our healthcare costs are rising, and smoking is the number one cost factor for the majority of illnesses that are killing everyone: cancer, heart disease, stroke. So even if we had, in Indiana, there's more than 1 million smokers. Even if we had 50,000 quit, life-saving, staggering. Money-saving, even more staggering.
Those are great numbers. Yeah, to put it in that perspective, healthcare costs. So Blacks are most likely to, according to the study, Blacks are more likely to benefit from this ban. And in this community specifically, you would talk about chronic diseases, and, Blacks tend to have more chronic diseases. Smoking is the number one risk factor for chronic diseases. Can you talk specifically about the impact this will have on the Black community?
Yeah, so in the Black community who smokes, 85% smoke menthol. It's a significantly higher number than any other type of patient that I see. So 85% of our Black patients are smoking menthols. My Black patients are more likely to die of lung cancer. They're more likely to die of heart disease and stroke than their white counterparts. They get treatment later, and they get less overall treatment. So the health disparity there is real. Many of my Black patients would not convert to non-menthol cigarettes. So the idea is we'd even see a higher percentage quit in that community.
Wow. Well, we have about 30 seconds left. Anything else you want to say about this this FDA ban and how beneficial it'll be?
I think it would be amazing. Anything that we can do to help our patients quit smoking would be just wonderful. I think that the tobacco lobby is pushing hard against it, as they always do, because they want to sell these products. Cigarettes are the only product that we sell in the United States that, when used as intended, is designed to kill you. So anything we can do to help people quit would be wonderful.
That's so criminal. Oh my gosh, it's so sad. Oh gosh. Well, I hope this pulls through and happens and will help so many people. Well, speaking about quitting, how can people prepare to quit as this sort of looms? What are your suggestions?
Yeah, there are many great things that people can do to help quit smoking. There are many smoking-related products, what we called smoking cessation aids. We have nicotine patches, nicotine gum, nicotine nasal spray. We have 2 FDA-approved medications, Zyban and Chantix, that when used together with nicotine replacement can work very, very well. It's very important to prepare, though. If you're the only smoker in your house, getting everyone else to support you. If there's more than one smoker in your house, both of you should plan to quit at the same time to help each other out. The other thing to know is that there are wonderful quit lines, 1-800-QUIT-NOW, part of the Indiana Quit Network. Super supportive, very helpful, because if it was just nicotine replacement, quitting would be easy, but there's so much more.
So we have medications out there. We have social support within your community, your family, your friends. Any sort of counseling, cognitive behavioral therapy, stuff like that would be helpful? Yeah,
there's great evidence that these quit lines help because they provide whether text or phone support, but there's also pretty good evidence at things like hypnosis and other structured tobacco programs, like the ones we have at community. They're really, really helpful.
Tell me about what resources you have at community.
Yeah, so at Community Health Network, right now we have a great nicotine dependence program. It's working mostly with our employees and family members of employees, because we know if we could help decrease smoking rates at community, we could save lives. We don't have large smoking populations among our employees, but we definitely have some. And we want to do everything we can to support them. So we have nurse practitioner-based coaching. We have products that are covered, just a lot of wraparound support to help.
Anything available to the public?
At this time, it's just for employees, but Indiana itself, within the Indiana Quit Line and many other employers, offer structured help.
Wow. Any last thoughts on this? Gosh, what do you say to someone? It's like, you can do this. We can do this. You've got help. There's resources out there. This is 100% treatable, or 100 recovery, or is 100% possible.
It is. And I've worked with so many patients who have quit smoking, and they feel so much better. It can be done. I always give this little pep talk. I lost my father to lung cancer from smoking in 2016. It was the most heartbreaking thing. I could not help him. I tried. So I know how hard it is to quit. I've seen it. It's affected me personally, but I've seen so many patients that can quit and live longer, better lives. So I say, do it for your kids, do it for your grandkids, do it for your partner, do it for anyone that loves you. It can be done.
Wow. I mean, that's, and I imagine the relationship you have with your patients, it's, what this is like. And that sort of has sort of a more of a connection between the two of you. And so you can really speak from the pain that you've experienced as a loved one. Oh, that's great. That's so great. I'm so sorry about your loss, of course, but a great sort of patient relationship and coming to you for your help. Well, this was a wonderful conversation. I really appreciate your time. Thank you so much.
You're welcome.
This has been Medical Minutes from Wish TV. I'm medical reporter Dr. Mary Gillis. Be sure to follow and subscribe to this podcast and check out new updates every week. You can also learn more at wishtv.com and when you follow Wish TV on Facebook.
This is the Medical Minutes Podcast with Wish TV's Dr. Mary Gillis. Be informed and stay connected for the latest news and information when you like, subscribe, and follow this podcast and discover even more from the All Indiana Podcast Network. Now at allindianapodcast.com.